Hashtag Breastfeeding Tips, the number 4HCPs. Episode 1. At the bottom of the screen is the U.S. Department of Health and Human Services logo next to the Office on Women's Health logo. Do you think women have the information they need to breastfeed? Dr. Michael Young, a neonatologist at Howard University Hospital, appears.
No, I don't think they do.
What do you, as a provider, want to know before helping a new mom breastfeed? An image of an African-American mother breastfeeding her child while talking to a white female health provider appears on screen.
I want to know what her perceptions are, what she thinks it's going to be like first.
Older white grandmother and white mother smiling at a newborn baby that the grandmother is holding.
And what her experience is, and if there are women in her family and in her life that have breastfed.
Why is that? A young white mother breastfeeding a child appears on screen.
Because if I'm working with a mother who has no experience with breastfeeding and no family support,
African-American baby lying on its back, and an African-American mother leaning over it. She is holding and kissing the baby's feet and is smiling at the child.
it's going to be a lot more detail about what to expect. That I'd like them to only feed exclusively human milk for the first 2 weeks.
White mother holding her baby to her chest and smiling down at her child.
So it's a little different discussion depending on the mother's breastfeeding experience, what she comes to the situation with.
For breastfeeding resources to share with your patients, visit womenshealth.gov/breastfeeding. Hashtag breastfeeding tips, the number 4HCPs appears at the bottom of the screen. The content and views in this video do not necessarily represent those of the Office on Women's Health in the U.S. Department of Health and Human Services.